Breast cancer is the leading cause of cancer death in the U.S. for Black and Hispanic women.
Wink News consumer reporter Adriana Shepard shares the story of one Cape Coral woman striving to make sure survivors have the support they need once their treatment is done.
Astrid Shover describes herself as a mom, a wife, a woman of God, a business owner, and a leader in the community. She never thought she'd add breast cancer survivor to that list.
I felt fine. I was healthy. I was running a business. I had 2 small kids. My husband was in law enforcement. And cancer was like the furthest thing from my mind.
But in the summer of 2018, she found a pea-sized lump. And on August 13th, 2018, she got the call no one wants to get from their doctor.
Your biopsy turned out to be cancer. Very cold. And from that moment, I just crumbled. I fell to the ground crying. My husband was there to console me.
According to the American Cancer Society, white women are more likely to be diagnosed with breast cancer than black women. Yet black women are 40% more likely to die from the disease. We're also more likely to be diagnosed at younger ages, at later stages of the disease, and with more aggressive forms of breast cancer.
I was diagnosed with stage 2 breast cancer. It was a lobular carcinoma, which is a very aggressive form of breast cancer.
But why are the odds stacked against so many black women? The American Cancer Society lists a number of reasons. Less access to high-quality health care across the breast cancer spectrum, from prevention to treatment. Black women are more likely to be screened at lower-resourced and non-accredited facilities. Plus, they're more likely to go longer between mammograms and between abnormal results and follow-ups. The organization blames systemic racism and its impacts on health and health insurance coverage for that.
Make sure that your health and your concerns are taken seriously. I had surgery 3 weeks ago to remove a lymph node. The first doctor passed me over.
After a double mastectomy and months of chemo, Shover went from breast cancer patient to breast cancer survivor, advocate, and recently nonprofit founder.
Because I didn't find or know of any nonprofit that really spoke to survivorship, especially for younger women. And I figured if I can't find it and it doesn't exist, why not create it?
She started Pink Divas United just a couple of months ago. Divas stands for Diverse, Inspiring, Victorious, Amazing Survivor. The organization's mission is to empower and uplift all breast cancer survivors, as well as their family members, through education, resources, and tools like mental health coaching to help them thrive once they ring that bell at the end of their treatments. Shover's journey still isn't over. She has other related surgeries scheduled this year.
Our hair grows back, we're done with treatments, we're done with surgery, and there's a mask that a lot of us wear that we're okay when we're really not. We're suffering with mental health issues. You know, survivorship is hard. We need our community to rally behind us. It can't just be about October.
Because people are diagnosed with breast cancer all year round. Adriana Shepard, Wink News.
Adriana, thanks. The National Cancer Institute says that there are ways to close that race and ethnicity disparity gap, like making cancer screening programs accessible to underserved populations and addressing the biological differences in breast cancer across racial and ethnic groups. Now, because of significant underrepresentation in clinical trials, there's now a push to include more black women, and experts say that could lead to better treatment and outcomes.